One, we are now live. TikTok live number 77. Guys, the top 5 listeners that hang on the live the longest, I give you guys a shout out in the caption of the YouTube and podcast, all right? So the first question came in the chat. Leo Momo, as a foreign trained dentist, can you get into OMFS without an advanced standing program? Well, the advanced standing program is going to be the 2 to 2.5 years of redoing dental school in the United States, right? There might be some programs. Someone told me that there's like a handful of programs that do accept you, but I would look to make sure that those are actually oral surgery programs and not like the oral surgery fellowship program where it's like a year. That's not oral surgery. That's like a clinic oral surgery thing. It's not oral maxillofacial surgery like US based, okay? That's like just more experience in dentovelar and extractions and stuff, okay? Beckett Shasker said, do you still perform things like jaw surgery in private practice? You can. I can. I'm looking into my hospital privileges now. But here's the thing, like, I don't know, on Long Island, hospitals aren't paying surgeons to take call, which, I did free work in all of residency. Like, we need to make a living now. You can't just, I don't know, other states, Connecticut, $5,000 a month. Palm Springs, California is like $15,000 to $20,000 a month. But to take call for free, I'm not really for that. So I got to figure this out because I need to get hospital privileges in order to register for the Part 2 board exam. But it isn't so clean cut. It's not so straightforward getting these privileges around here. And I'm not taking call if I'm not getting paid. Why should I do free surgery for like that? That's really disrespectful, honestly. And I'm seeing a lot more stuff like that going around. G said, what kind of extracurriculars did you have when you were applying for dental school? When I was applying for dental school, bring me back a ways here, I was a part of the Catholic Club at NYU Polytech. I was at 2 colleges. I did my first 2 years at NYU Poly. That's NYU Tandon School of Engineering now. My second 2 years where I graduated from was Stevens Institute of Technology in Hoboken, New Jersey. And at the Catholic Club, that was at Poly. I played basketball through most of college except for the last year. Stevens, I was in the Irish Club. I did some research at Stevens with Dr. Glavy's lab. And yeah, so those were a couple things. Let's see, what else? Yeah, those were the most important ones, I would say. But yeah, that's mostly it, yeah. Hazzy said, did you finish dental school? I did finish dental school. I finished dental school, 4 or 5 years ago, 2021, so 4 years ago? Yeah, 4 years ago. Yes, thank goodness that's in hindsight now, right? Jackson, how much free time did you have during residency? Not much free time. There was a point, and it was longer for me. In fact, now that I'm in hindsight, I had to pretty much do, it was like a year and a half of intern year because the program was down a couple residents. They switched the program and sent another 2 to 4 off to medical school, right? So because we have 2 6-year residents a year that do med school, 1 4-year resident a year. I was one of the 4-year residents. And so after my first year, they started to push the 6 years would stay 6 months and then go off to med school for 2 years and then come back. But after my first year, they sent them right away off to so they would do like literally 2 weeks and then, or a month, 2 weeks to a month, and then they would send them off to medical school. And now that would put us in a 6-month deficit times 2 for 2 years, right? So we'd be down another 2 to sometimes 4 residents in a 4-year period. And so who would have to make up for all those call shifts, for all that intern work? It was the 4-year people that were on service and the other 6-year people that were on service that had to make up for that. Yeah, so like my second year, I was still taking call 5 times a month. I was still on call 2 to 3 weekends a month. And that was my first year. My first year, I was on 3 weekends a month. So it was 6 days a week. It was 3 weekends a month. And then it trailed into my second year because my second year I was the 4-year person and we were down another 2 residents. So I was still taking call 5 times a month as a second year. Into third year, beginning of third year, the first half, I was still taking call 2, 3, 4, 5 times a month. So yeah, that was a lot. And God, that sucked. Anyway, that's another thing. I really don't want to take call anymore. I don't want to take call anymore. So I got to figure that out with all the stuff on Long Island. I got to get the boards registered, but they're not letting me register until they see boards privileges, hospital privileges. Ishan Kapoor, you are genuinely my inspiration. Oh, that's very kind of you, Ishan. What do you inspiration for what? What are you going for, my friend? Hazzy said, what advice will you give someone applying to dental school? You got to give it some time. Be patient, right? Make sure you get a good application, get the DAT, get a good GPA, do extracurriculars that you're passionate about, right? Because they're going to be brought up on your interview. You got to do some like the interesting stuff, like the Catholic Club, like the Irish Club, stuff like that. My research was kind of brought up on interviews, but when you're having a conversation with someone, you want to connect on like-minded stuff. So there was one admissions person at Toro who we were just talking about basketball the entire time. His son was in high school playing basketball. I played basketball in college, so we were just chatting about that, and it was a good time. It was a lot of fun. being able to do that. And so remember that when you're applying to dental school. L said, were you interested in LIJ OMFS? Well, no, not really. I gotta be honest with you. Let me paint a picture though. I went to Stony Brook Dental School, and LIJ is the affiliate program of the Stony Brook Dental School, the oral surgery residency program is basically linked up with Stony Brook, right? And I didn't like that they literally have to drive all over Long Island. And now they're covering Lenox Hill in Manhattan too. So now they're driving all the way in, sometimes from Manhattan. They have stuff all the way out here in Stony Brook. It's an hour and a half to 2 hour difference depending on traffic. And when you haven't slept for a couple days, when your pager's getting hammered, you're getting hammer paged, and you got to answer all these calls, and then you're driving around Long Island too. I think that's a really dangerous recipe. I do. So those are my thoughts. I didn't want to be a part of something like that, and therefore I did end up ranking NYU #1. And I picked an apartment. So we cover 3 hospitals in a row on the east, in Kips Bay, east side of Manhattan, right? And I picked an apartment right across the street, literally right across the street from the middle one. So it would be a 5 to 10 minute walk commute. No driving, still kind of dangerous on First Avenue, not gonna lie, especially with the guys on the bicycles. Other than that, very doable, much safer. Yeah, the commute, minimizing the commute time, I think is a very valuable thing to look for in whatever stage of life that you're in. You know what I mean? Gatorade Alley. Tips for my protodontic, please. Propadudec? I don't know. What is that? I don't know. Steve, do you love teeth more than your own family? No. I like my family and friends a lot more than teeth. I pull out teeth for a living. What do you mean? Davey said, "What's up, Davey? You're in the top 5 to 10. You're like in the top 10, I would say, consistently week after week. So thank you, Davey. I appreciate that. How hard is it to get into Stony Brook Dental School? I am a New York City resident. It's tough. It's very competitive. They have a small class size. I think it was 44 in my year. I think it's like 48 now. Hopefully they continue to keep it small because you really have to build more of a clinic in order to get more things in there. So I think that's a great school. It is very competitive. It's very hard, but you can do it. Just make sure you get your grades, get your DAT. You'll be fine. User 50487 said AEGD or GPR. Now, I didn't do either one of these, so I'm not really sure. I think it depends on the state, right? It's different states kind of treat either one differently, I think, more or less. You know what I mean? Like, not. G said, did you get any clinical experience before dental school or just shadowing? I was a surgical assistant for an oral surgeon for my gap year, and I got a lot of experience there. Started to learn how to talk the lingo, and that helped out on interviews. So now it wasn't clinical experience, but yeah, I was taking impressions when they were doing night guards for TMJ and stuff. So I thought it was good. G followed the life creator. Thanks, G. Lowly DKTB. Hey, how's it going, brother? Love the content. Thanks, man. And thanks for coming on. It's going good. It's going great. Work is extremely busy. I like being busy. I'm really enjoying it. I think my computer should be up and running this week. They set up a desk. I've worked 3 full weeks. They set up my desk like 2 weeks ago, and then put it the computer a week ago, and now they're setting up the computer, and I think this week I can finally have my own computer and desk and work there, and that's going to give my routine in the office. So in between patients, getting notes up, and then also maybe like finishing posting the podcast from the night before, or maybe getting a question of the day up. That's something that's really important to me, to multitask at work. After I am caught up with all notes and everything, I do a lot of work on the side, and I talk to clinicians throughout the world on LinkedIn, which is a very important part of my day and my educational experience, to learn from people in India that have seen this crazy rare lesion. And yeah, LinkedIn, I really like that. So I need more time during the day in the office to do that, and part of that is being more efficient. And when I'm splitting a computer with another doctor in the office, it's tough. So I'm excited for this week when that's all set up. And I come into the office, I just throw my laptop, iPad, open up the computer, and it's like go time in 3 minutes. That's my. I'm excited. You can see this. It's a passion of mine. Yeah, I'm really excited to do that. But it's been good. It's been busy. I'm trying to get down the routine here at home too, where getting to bed up early, doing some studying for the boards in the morning. That's a big important thing to me. Doing my 10-minute ab workout in the morning. I missed every day last week for both studying and abs. Just molding, adjusting to the routine it's tough. You have like 2 weeks of like very high adrenaline, a lot of excitement. It's a new role and everything. And then after about 2 weeks, you start to settle in. And then I was like, I need to get some sleep this week, because I've been going to bed at like midnight, 1 o'clock, just with everything I got to do at the end of the day when I get out. But yeah, thanks for asking, friend. Yusra said, would you fix Brendan Gallagher, hockey player, on the Habs teeth for after trauma? I can do that. Yeah, no problem. I could do that. Now I won't be able to do the general dentistry work. I don't do general dentistry anymore, but I definitely even yeah, laceration repairs. I should do like laceration repair for like MMA. What is it? Yeah, MMA fighters, right? That would be fun. That would be a really that would be a lot of fun. I did it before. I did UFC fighters. They came to one of the city hospitals that I was covering on call, and I did a couple of their faces laceration repairs. Nothing too major. It's funny, they look so bloody on television, and when we got there, they were like, there was no broken bones. There was like one guy had a big laceration, the other guy had three small ones, and stitched them up. Yeah. Hazzy says, does GPA play a big role on getting accepted, or the DAT? Yeah, both play a very big role on getting accepted to a dental school. That is correct. Nicolas Rodriguez, what's up, Nicholas? Submitted apps in June and still waiting to hear back. Any tips on how to get through the waiting? Distract yourself with other things. Be productive. Don't dilly dally. But be patient. You got to be patient. You know, most of the invites go out in like October. If I remember correctly, it was mostly October that I got all my invites. I was 5 for 6. I applied to Stony Brook, NYU, Oro, Buffalo, Rutgers, and UF in Florida because I have family down there. But they take mostly in state, so I didn't get UF. Understandable. And then I got the other 5, so it was 5 for 5 for the other ones. Yeah, they all went out. I think it was October. I don't remember getting one in September. I think it was all October, if I remember correctly. I might have even got one in November. No. I'm pretty sure maybe it was like September, October. You got Nicholas. You got plenty of time. Okay, focus on other things in the time being. Okay, maybe you call up their like coordinator, the person who kind of receives the applications, and say, hey, I just wanted to make sure that you received all my things. This one thing might have gotten separated. I just wanted to double check. That's fair. You know what I mean? That's fair to ask. Caspian said, is orthodontics specialty worth it? I'm a D2 and my grades are pretty good. I think it's worth it. Orthodontics is a great specialty. My best friend's an orthodontist. He's from Great Neck. They're in Glen Cove now. He's doing Lion Orthodontics. So shout out to Sean, Dr. Czar, or Dr. Sean. I think a lot of the orthodontists, they do doctor of their first name. I just do my last name because that's like, I don't know, where I put myself on social media as. Hazzy said, how many days are you live, LOL? How many days are you live? I try to do one live a week on Sunday evenings, like tonight. I try to do that as best I can. I don't know if you're able to make it next weekend. I'll try, but yeah, I try to get like a quick 45 minutes up, or 15 even, anything. I'll be on it a little bit longer. I'll do at least 30 minutes tonight, but I think it's good. It's a good question answer. However, I can help you guys out with questions you got, One Stop DDM said, could you be real? How much do you get paid? I don't know, like, what's, in residency, it was really poorly. Residency, a lot of the problems would be fixed if they would actually pay residents what their work, not even what their work produces, but pay them 40% of what they bring to the hospital. No one's going to be complaining about working 6 days in a row. You see what I'm saying? It's like, people have loans to repay. People are trying to actually go to a nice dinner. They're one night off a week, and they deserve it. I couldn't do that. So if you could pay residents as if they were full-on surgeons, it's so important. Aramo Ayedi, Ortho and OMFS best duo. They are a good duo. They're a really good duo. I'm also liking OMFS and Prost, or OMFS and GP, because we could plan all in X cases together. But for orthognathic surgery, orthodontics and OMFS are the big dogs for orthognathics. What's the Caspian? I ought to pursue a specialty. Yeah, sure, go for it. Make sure you pursue something not for the career path is important, and making sure that you can see yourself, envision yourself doing these things in the future. That's really important. But also, you make sure you like what that specialty does. We really got to observe and shadow those surgeons, maybe if that's you know what I mean. You need to observe what they actually do, so you know what you're getting yourself into, right? And what their day-to-day looks like for their 30-plus year career, because you want to make sure you're going to be happy at the end point, right? There's going to be growing pains through the middle of it, but you want to be happy at the end. User 904 said, I have a tooth that keeps wandering lower jaw, middle, pushing forward. Used to have a retainer. Wandering lower jaw. Where? In the lower jaw, in the middle? Where in the middle? And I see, I'm at Cornell right now studying bio. I literally want to do the same thing as you in the future. Do it. I know Stony Brook takes a lot of undergrads from Cornell. Do it. User 904, big teeth, small jaw, what should I do? Well, I don't know what your situation is. I haven't seen your x-rays. I haven't examined you clinically, so I can't give you the best insight, unfortunately. But if you go and get a consult at your local dentist and oral surgeon, I'm sure they could shed some light in what direction to go. You know what I mean? I think that's a really good idea. I think you should get a consult with them. G said, what was the OMFS process for you? OMFS process? Well, after undergrad, you take your DAT, you got your GPA, you apply to dental school. Then you go to dental school. I took a gap year in between undergrad and dental school because I took my DAT just after I finished undergrad, right? Zara Moyadi, follow the live creator. Thanks, Zara. And I took the DAT right after I finished undergrad. So that was May. No, I took it in July 21st, I remember. That was after graduating college. So then I had to take that gap year, right? And in that year, I worked as a surgical assistant. I was lifeguarding at 2 different places. I was working out, reading books, podcasts, doing stocks and stuff. Yeah, the music producing was my favorite thing. Then I started dental school at Stony Brook. That was 2017 to 2021. Applied to oral surgery. You got to take the CBSC. You got to get good grades in dental school. You got to do externships and maybe research if you want, not required. And then I went to OMFS. OMFS is 4 or 6 years. I did the 4-year track, and now I'm working as a full-on oral surgeon finally. D Money Swag 4 said, what would you recommend to an M4 giving signals now trying to get into trauma surgery? I would spend as much time with the trauma surgeons as possible, and I would try and travel to other hospitals, get to know their trauma surgeons. If you want to get really good trauma experience, you want to go to a level 1 trauma center like Stony Brook out on Long Island, or Bellevue in Manhattan, or I don't know other level 1 trauma centers. I think Kings County. Kings County is a level 1, no? I think Kings County is level 1, pretty sure. Henry D2 says, started prepping for the CBSE, aiming for 3 hours of study on 4 days of the week. Aiming February, do it, Henry. You gotta go all in. You gotta go all in, balancing that on top of your classes in dental school as well as clinic. You're gonna be starting clinic soon, right, as a D2? So that's something to consider. 3 hours on 4 days of the week, 3 hours total, or 3 hours each of 4 days a week? I hope that's each of 4 days a week, so you can get at least 12 hours in. You're going to need those hours, man. Cheeto Bro said, how do you see AI affecting surgeons? Do you think they'll replace them? I really don't. Yeah, if we're talking 50 years into the future, 100 years in the future, maybe. But here's another thing, that human-to-human connection is not going to be easily replaced by AI, and there's always going to have to be a human involved with surgery, I think. There just is, because, I don't know, I really think, peripheral vision during the surgery, not literally peripheral vision in the surgery, but all the factors at hand. Yeah, because right now, surgeons, bariatric surgeons, they're using robotics to minimize the incisions, to minimize bleeding, to minimize length of time in surgery, perhaps, but they're still controlling the machine, We'll see. I think it'll be adjunctive. It's like you're going to use AI to evaluate an X-ray. You're going to use AI to, evaluate, to fix this problem for this patient, would you do this procedure or this techniques-based stuff? I think that's what it's going to come down to, weighing out pros and cons, making the day-to-day go less administrative work and more doing the work. That could potentially be it. Care Notes is something that I'm looking into, and I use every day right now. Care Notes is an AI app. It listens to you speak as you're talking to the patients, and it writes down your note for you. It keeps all the previous medical history, previous surgical history, meds, allergies, and it's been really important, because sometimes I go seeing 10 or more patients at once without sitting down and write a note. How are you going to remember all the little details that you had in those conversations? Care Notes does that for me, and that's a really huge part of my day right now, in order to maximize going in between the rooms, being in the zone for surgery, and then being in the zone immediately after for another surgery in another room with another patient, without having to worry about that. I just hit record and put it in my pocket and go. So yeah, Care Notes has been a big part of my days starting out right now. Gotti said, what did you get on your DAT? I got a 21 academic average, 22 on the PAT, and then all of the other portions where they do the average, the sciences, it was 24 in Orgo, 22 Gen Chem, and then I forget the rest. I guess it was less. It was 19 and 20s between 19, 20, 21 between bio, reading, and math. And nowadays they're adding on physics. I think that's the stupidest thing, but these people are just being, they should add on hand skills. They should add on a hand skills portion, because you need to do a lot of hand skills as a dentist. I don't know why they don't have block carving or something anymore. I think it's the stupidest thing. They should definitely have that instead of physics. But who's coming up with this stuff? Why are they putting physics on the DAT? Put hand skills on the DAT. They're going to be future dentists. They got to be good with their hands. I think it's common sense, right? Does anyone disagree with me here? Physics or not, I think there should be a hand skills portion on the DAT. Yes or no? Let's throw it in the chat. I want to see this. Roise Lee said, as a new attending surgeon, how often have you been asked your fellow surgeons for help? All the time. all the time. And sometimes patients like to have another surgeon, just run their eyes on something real quick. Not like all the time. I mean, I go days without having to ask a question or anything, but I do like to see what other people's thoughts are, what other surgeons in the practice would do for a certain lesion or for this technique or this procedure. Like, hey, what do you think about where this implant's placed? Should I go on the mesial site or the distal site? I literally called up the GP dentist of the patient I was working with in drop, and I was like, hey, what do you think of this implant placement? Do you want it somewhere else? Implant placement? You want it somewhere else? I'll put it for you. Just let me know right now. You know what I mean? I want to work with other dentists in the community. I want to work with patients in the community. This is Long Island. I'm on Long Island. I'm born and raised here. This is my neck of the woods, And I want to work with other dentists doing this. I really find it exciting, and I hope that they enjoy working with me too, because I want to do a good job for them. So let's see. G said, when you were a surgical assistant, did you need to have certificates or more on-the-job training? Mostly on-the-job training, but then like CPR, maybe one other thing. But I had that already because I was a lifeguard, so it was fluid. You know what I mean? All right, let's Money D Luffy, follow the life creator. Thanks, man. Zara Moayedi said, Zara Moayedi. There we go. Sorry about that. I'm a Mexican dentist about to start my process for an advanced training program. Can you work during that? It's tough. It would be tough to work during. I don't know how you'd be able to do that, and you wouldn't be able to work as a dentist during that, right? But you can definitely work doing that. I think. Kui Quay 5315 said, do a flip. I cannot do a flip, nor do I want to. The disability. JFCJD said, hey doc, saw a recent video with Dr. Chatkin. Awesome video. Thanks, man. Yeah. That's the one you're talking about is the Long Island Dentist podcast. I'm going to start this new podcast where I'm going to get all dentists throughout Long Island to come on and we chat, just chat. I want to get to know them. I want other dentists to get to know them, develop that professional connection as well as just a friendly connection. And I think it'd be really good if people on Long Island can get to know their dentists a little bit through listening to the podcast, right? Imagine you're a high school student and you want to become a dentist, right? And your mentor did a podcast for 45 minutes with another dentist, right? You listen to that podcast 10 times a week, right? I had a couple mentors that I met at the gym, 2 general dentists and 1 oral surgeon. If they did a podcast, I would have listened to that podcast like 50 times. That would have been my ultimate motivation. You know what I mean? So I want to create that opportunity for people that can get to know their mentors a little more. So anyway, you get it. Thanks. JFCJDB said, how has work been? Anything new? Nothing new. Just working very busy. Monday through Friday, and I'm liking it. I'm liking it a lot. I just got to get into a routine more. And yeah, I got to work on this hospital privileges thing. This is going to be tough. A lot of them want you to cover clinic or take call a couple weeks a year. Teach people. And in a way, it's reasonable, but they're not paying you to do these things. So it's like, excuse me? I can't wrap my head around that, dude. Because you can't take that. Like, I'd have to take off a day of the week of work to go like cover their clinic or something, but do that for free when other states aren't, like, they pay their surgeons to do that, right? You need to pay someone to do it. So I don't know. I need to talk to someone about this because I'm not liking this. Zara Moyetti, how is the life of a dentist in New York City? In New York City, in the city, pretty tough. Competition's high. The reimbursement by insurance for those rates is very low, so a lot of dentists don't take insurances, which I think makes sense because the insurance, they need to pay what it costs to take out teeth, to do preventative care. And they're really not these days. So it's very tough as a dentist in Manhattan, but you need to find like the pocket where you're doing best. D Money Swag Force said, does Stony Brook Southampton have a trauma center? I don't know. I'm not familiar with Stony Brook Southampton. Cyrus said, any big cases you've done at work? Goectomies, sinus lifts. I haven't done a sinus lift yet, actually, now that I think about it. I've just been in 3 weeks, right? So they're mostly a lot of teeth, wisdom teeth, implants. I'm having fun. Finally. I love it. I like doing oral surgery. I really do. And this is the life I envisioned. It's and I hate taking call. A lot of surgery, we got to take call. I got to figure that out. This hospital privilege thing, I mentioned it so much on this chat. That's something that I got to figure out. Gotti said, I just took my DAT. I got a 23 on it. Congrats. That's a huge score, Gotti. Well done. Very well done. Special Joey said, hey, one of you guys saved me. Saved you? I lost 80 pounds after my surgery. Had a Lefort osteotomy. 80 pounds after Lefort? 80 pounds is a lot. Whoa, wait a minute. What did your oral surgeon say about that? That's a lot. And good, and I guess, I don't know what your starting weight was, though. Gotti said, yeah, maybe they put hand skills. Ain't no way they're going to put physics on that. They are. Dude, they're literally putting physics on the DAT, and I think it's the stupidest thing. I really do. You're applying for, they're adding on more DAT. It's so stupid, man. Why are they doing this? Why don't they like think a little bit, put hand skills on it, right? That's going to be half your time in dental school is hand skills, handwork. Zara Moyadi said, after dental school, any tips to get into ortho? Yeah, they like to see research in ortho, that's for sure. Really good grades, really good standing in your dental school class. Those are the top things I would say. Jazzy said, wisdom tooth question. I was rinsing earlier and some blood came out of the socket. What should I do? If it's bleeding, now you said blood came out of the socket. This is not medical advice, but my personal advice would be, if it's bleeding, pack it with gauze. Don't spit. Don't rinse. Don't rinse within 24 to 48 hours. You gotta wait. If you're bleeding, you pack with gauze and compress. You compress for 30 minutes at a time until the bleeding stops. But don't spit. Don't use straws. Don't rinse your mouth out. Don't smoke. Things like that. None of that. No heavy lifting. No strenuous exercise. Don't be going out there and running a marathon the day after you have your wisdom teeth removed. As he said, I'm panicking right now. Don't panic. Panicking is definitely not gonna help. Definitely don't do that. You're gonna be fine. I can tell you right now. You're going to be fine. John J. said, I'm applying to residency next year for IM. That's internal medicine. Excellent. Any tips for pre-charting and rounding? I'm disorganized. Yeah, my thing is To Do. To Do is an app by Microsoft. I have it on all my laptop, iPad, phone. I organize my entire life based on that. You can organize your routines, schedule, classes, courses, whatever you, events, meetings, podcasts. I got everything on there. So Jazzy said, I'm using gauze to cover up. Where'd it go? I'm using gauze to cover the site, but still have blood coming out. Compress. Don't just cover the site, compress. Bite down and hold it there for 30 minutes. Okay, Jazzy, that's what you got to do. All right? And look, if it's gushing out blood, that's one thing. But if it's just a little ooze, a little bit of pink or red on the gauze, that's okay. That's okay. It's going to be all right. That's normal. You know that, right? Just compress with the gauze 30 minutes at a time. Switch out the gauze every 30 minutes. Compressing. Don't chew on it. Don't talk while you're doing that. Focus on compressing for the full 30 minutes. And then switch that out for 30 more minutes every time until the bleeding stops. All right? Jed said, is it more easy to know what to do as you practice and get used to everything? Yeah, you get used to it. It's reps. You know what I mean? Rasim said, opinion on figs. Are they worth it? Haha. I got a couple pairs of figs. I got a couple of Genu. I have one pair of MIM scrubs. And actually, I do like all of them. I think I might be leaning more towards these, it's like dry light or light something, the Genu. I think I'm liking the Genu. They contacted me and sent them to me. They said, hey, we got these new scrubs. I like them a lot. I'm a heavy sweater, and these are nice and light. They're comfortable. Pants. I have the straight leg pants ones, and they're really comfortable. I'm a big fan of them, the Genu ones. Figs are good. They're nice. They're soft. They're a little bit thicker. And but yeah, I'm really digging these new Genu ones. I forget what it's called. It's like dry light or something, light dry. I don't know. Poppy Harlow 458. Do you guys give blocks for certain procedures in OMFS? Yeah, we give blocks. We give inferior nerve blocks. That's the one in the back that we go back, and then we go around the site. Yeah, on the mandible. That's for surgery on the mandible. Stars said, hi, I'm a second-year dental student at Tufts. Oh, sweet. Nice to meet you. And I'm interested in OMFS. Any advice on what I should do? Yes. Second year, so you need to start thinking about taking that CBSE. Okay, that's what you need to start thinking about. You need to maintain your grades, keep high standing, get a good ranking, get that CBSE out of the way. Then you're going to start doing externships. Externships is when you spend about a week observing and helping and assisting residents and the attendings at oral surgery programs that you're interested in going to. Okay, and then letters of recommendation from there. Maybe assisting in the OR, your journal club. Okay, that's what you're going to be looking at from here at Tufts. Good luck. Let me know, and just send me a DM on Instagram if you need help with anything like that. As you said, okay, thank you so much. That makes me feel better. Yeah, don't freak out. Don't freak out. Just relax. Remember that. If you see bleeding, literally on your arm too, compress. You hold pressure over it until it stops bleeding, okay? You're going to be just fine. Jocelyn said, tips for DAT. Study hard. I'm going to match how much you gave me. Tips for DAT? Study hard. Jazzy sent a rose. Thanks, Jazzy. You got it. John J said, any tips for presenting to attendings? I get nervous. My plan isn't good. You could always rehearse it, and if your plan isn't good, then you need to adjust the plan, right? Just keep it succinct, SOAP notes, right? Subjective, objective, assessment, and plan. Just stick to that. That's the best thing you could do, all right? Try and make it nice and succinct. Zara Moyetti said, what is the best dental school in the United States? There's a lot of good ones. There's over 70, 75 now, because they opened up a bunch of new ones in the past couple years. But the best one, I don't think there's like one that you could point to. And there's different things, like best for applying to a specialty. There's best for your area. There's best for tuition. There's best for culture. There's so many things to consider. Rasim said, also, any tips for waxing up a tooth? Hate it, not gonna lie. Yeah, I usually like to just goop as much wax on there as possible, and then I would carve it after. That was my thing. I wouldn't build up certain areas with the wax. I would just carve it after, carve it down. That was That was my thing. Yeah. SKFM. How many days are you working currently? 5 days a week, Monday through Friday. I'm not really a fan of working weekends. I did it plenty in residency. I did plenty of 6 days a week through residency, overnights, working a couple days without sleeping, and I can't stand taking call. I really don't, especially taking call for free. Not my thing. Not really liking that. SKFM. Just here we go. Scoob said best CE route externships for generals want to do implants and bone grafts after school. I don't know. I'm not doing that. I did residency, and that's where I learned how to do all those things. So that's how it goes. Wow. Jocelyn's second attempt DAT. Excellent. Get it. Liz said, did you get accepted the first round of admissions? I did. I went 5 out of 6, right? Because UF I didn't even get an interview at, but then I interviewed at NYU, Stony Brook, Toro, Buffalo, and Rutgers, and I did get accepted at 5 out of 5 when they sent. It was like December 1st or 2nd, a couple years ago. No, that was like 8 years ago now. Now, if you think about it, wow, 8 years. It's a ways back. Jocelyn said, how old were you when you went to dental school? I was 22 or 23. Yeah. And then I was, 27? So maybe I was 22, 23. I think it was 23. And then around 27 when I graduated, went to oral surgery, and then I'm 31 now when I just graduated. 10-25-72. Brandon, you are great. I remember you from the hospital. Good luck to you. Thanks, man. Where, which hospital? Where did we meet? Rassim said, also any tips for applying school with pass-fail? System and no ranking. McGill, did you hear eyes on ortho? For ortho, I don't know, because usually if you're applying to oral surgery at a pass-fail school, it's the CVSE that they're going to really kind of compare you to other applicants. So, but for ortho, I'm not sure. Just stick with it. Maybe letters of recommendation, research. I think that's probably 2 things you could look at for ortho. Star said, thank you, I appreciate it. I'm worried that my rank is the best. Can a good CVSE outweigh average rank? Yeah, your CVSE can really help. Thanks, Vadim. Scoob said, I just answered that one. Prosthodontics, where was that? Zara Moayeti, what's your least favorite dental specialty? Probably, because prosthodontics, I liked fixed prosthodontics, like crown preps and stuff, but I didn't like the denture work. I did not like stuff with dentures, and I wish I did, because it helps learning the restorative method, restorative-based all-on-X surgeries. SKFM, hell yeah, man. Well, I'm glad you got your schedule well-deserved. Thanks, man. I appreciate it. Chicken Bake Muck said, what are your thoughts on periodontists doing IV sedation? Can they handle all the complications of IV sedation? If you can't handle the complications of IV sedation, and I really think it takes at least 6 months of being an all-on anesthesia resident, which oral surgery we do. We spend 6 months on anesthesia, being full-on anesthesia residents, and we have to manage those complications. We learn because we're like anesthesia residents at that point. So, but periodontists don't do that. They don't do that. So to be doing IV sedation, I think that could be very dangerous if you don't know how to manage the complications. If you do any surgery and you don't know how to manage the complications that could be caused by that surgery, that's not a good situation. I don't think so. You got to be able to handle the complications that you could potentially cause or can happen. Annie Gabriella Pinzon. On your residency, docs were respectful to you, because here they kind of bullied people. I've heard it can happen. Zarmoida, what was your least favorite class during dental school, and which one was the hardest for you? The hardest was, I think it was periodontics. That attending did not like me. She would rip up my exams, and yeah. I don't know. She had a bad attitude. My least favorite class. That was my least favorite class. Which one was the hardest for me? I don't. Hardest endo. I got like 100 on the endo final, which is pretty cool. Having the top endo score. That was all right. I guess I'll take it. Hardest. I don't know what the hardest was, though. Yeah. Star said, thank you, I appreciate it. I'm worried that my rank is the best. Can it go to CVC? Yep, you can. Jed said, so are you in residency right now? No, I just graduated. Vadim said Bellevue. Oh, nice. Where were you? Because I can't see your name. It just says Vadim. That's sweet. Are you still at Bellevue? Where are you at now? The Kitty in Black said, how is your board prep coming along? Maybe I missed your response. It's coming along. It's not as great as I'd like it. I'm still getting into the routine with work, and then after that, we're trying to do with the other surgeons at the practice who are preparing for boards. We're going to do like 1 day a week, prepare presentations and stuff, but I also don't know when I'm going to prepare those presentations, because it's like the week is very busy, and I'm getting home late and getting up at 5:30 to try and study before I go in. By the way, guys, if you're an undergrad, if you're in dental school, if you're a resident, like studying for a little bit, even just 30 minutes before you go in at the day, when your mind is sharp and most alert, I think that's the best. I think that is the way to go. See how it helps. And breaking up studying a little bit like that too can help too. Star said, I may sound crazy, but I love RPD and CD classes right now. No, that's great. That is great. That really is good. I'm telling you. Chase Kreider said, about to enter interview season for OMFS residency. Best piece of advice for interviews? Well, congrats. Excellent. It's just a conversation. They're not going to quiz. Maybe some crazy places will give you an X-ray or ask you to do a little for it. But I mean, personally, I wouldn't expect a dental student to know how to do that, nor should they know how to do it at that point. I would want to make sure I connect well with the interviewer, right? So yeah, just consider that. It's a conversation. You're just chatting with them. You're giving them professional answers. It's going to be okay. All right. Make sure you dress up. Make sure you come presentable. Get there early. Everything. Danny, applying with this upcoming cycle. Any advice? Yeah, be patient. Be patient on stuff. Make sure you get all your ducks in a row. Apply as early as you can if you can. And go from there. If you want more advice, like kind of specify what advice you're looking for, Zara Moyetti said, did you have another option for dental specialty if you didn't get into OMFS? It was either OMFS or GP. I wasn't going to do another one. User 2435, who do you use for malpractice insurance? Our practice pays for that, and they use OMSNIC. I do a partnership with a collaboration with MedPro right now. MedPro is really good to consider. They do I think it's $50 for the first year, or free for the first year, and then $50 the second year, and then you pay normal fees. MedPro, we do a series of malpractice cases. So we review cases that became malpractice, whether it went to court or came to the lawyers and stuff. And we go over what went wrong, how to prevent it from happening. And I like learning for this myself. And so I'm just so lucky to have Dr. Mark Leffler. He's an oral surgeon and an attorney that has been on these cases in the past. And we go through it together, and I get to learn from it. We record it so that you can learn from it too if you like. Yeah, I think it's really good. All right, friends. Thanks for coming on. That's it for today. We're hitting 41 minutes. Guys, top 5 people that stayed on the entire live. I'm going to give you guys a shout out in the caption of the podcast, the YouTube, everywhere. So thank you guys for joining. This is TikTok Live number 77. Yeah, I love you guys. You guys are my podcast family, so thank you. And I'll see you guys. I'll try to get on next Sunday. I have a family lunch Sunday, so we'll see if I get on that night. But yeah, so this is for this week, TikTok Live number 77. Again, top 5 people that are on the whole time. I'm going to give you guys a shout out in the caption on YouTube and podcast. All right, friends, have a great week. Let's make it a good one. Khalid said, then would you appreciate bring up rec letters towards the end, right before you're applying? So that would be around May of your D3 year when you're applying, right around May. Bring that up with them. All right, friends, Sebastian Escobar said the GOAT. All right, guys, good night. Have a great week. All right, well done. Let's do it.